Hey everybody, it's Dr. Paul Thomas with Startup DPC, and a question that comes up a lot is how old are the patients in a typical direct primary care practice? Now, I cannot answer that question. I can't say, oh, everybody's practice looks like this, but what I can say is exactly what our practice looks like here at Plum Health DPC. So right now we have 600 plus patients. I have about 450 plus patients, and Dr. Raquel has 168 plus patients. And I'm going to show you this graph right here that shows the age distribution of all of our patients. Now, starts down here. We have some patients who are between the age of 0 and 1. It looks like there's about 6 patients. We have maybe 6 or 7 1-year-olds. We have about 10 2-year-olds, 10 4-year-olds, a smattering of pediatric patients. And then just FYI, each individual line here is an individual patient. So, you're looking at maybe 10, 23-year-olds, but then when you get to 26, perhaps we have 20 plus of those 26-year-olds in our practice. And I think there's a couple things at work here. You can see that the majority of our patients are between, let's say, 20 and 65. Roughly, 80% of our patients are between 20 and 65, with the majority of our patients, maybe a solid half of our patients coming between like 26 and 50 years of age. I think there's a couple things at play here. So first of all, I'm 32, and so I'm attracting people in my social network through Facebook and Instagram and LinkedIn. And a lot of the people that use these platforms are in my age, in my demographic. Instagram probably skews a little bit younger. Facebook probably skews a little bit older, but you get the idea is that, when I'm marketing my practice using these platforms, these are the people that I'm targeting and these are the people that I'm reaching because I have a ton of friends who are 30, 31, 32, 33, 34, etc. That's my immediate demographic. The other thing at play here, as you probably know, is that the Affordable Care Act covers individuals up to age 26. And then once you are become 26 years of age, you age out of your parents' coverage. And I think that's a nice provision of the Affordable Care Act. The other thing at play is Medicare. Medicare kicks in at 65 years of age. So a lot of patients are relying solely on their Medicare, perhaps because they're on a fixed income after they turn 65. So here's where you can see like the majority of our patients are between that 26 and 65 years of age. And those are probably some of the external factors that are pushing people in that direction. Let's go on the opposite end of the spectrum, the geriatric patients in our practice. So we do have a 102-year-old. Like I said, each individual line is an individual patient. We have a 93-year-old patient, an 82-year-old patient. Looks like we have an 80-year-old, a 79-year-old, a smattering of people between the age 65 and 80 there. So that's it. That's our practice panel. I know this question comes up a lot where doctors are thinking like, okay, what are my patients? Who are my patients going to be? What are their ages? The final point that I'm going to make is that, and I talk about this in my courses too. So if you want to take a deeper dive on these subjects, you can check out our courses on the Take Action part of this website. But one of the big things here is like, I specifically know what my patient looks like. I know that my patient is 32 years old. They drive this type of car. They shop at Whole Foods. They live in this type of house or apartment or in this neighborhood, right? So the more you can key in on your demographic, the more successful you can be in your direct primary care practice. I was just kind of throwing some things out there. That's not exactly my target demographic, but if you know that your patient is 45 years old, they shop at Ace Hardware, they shop at Kroger, and they drive this type of car, the more specific you can be about your patient demographic, the more successful you can be. Because you don't have to waste your time chasing after everyone. You can just kind of key in on your core demographic. All right, I've said enough for today. If you want to learn more, check out some of our courses on the Take Action page. I take a deep dive into some of these topics, and you'll find a ton of information there. Thanks so much for watching. Have a great day.